Hello, future nursing heroes! Are you ready to test your knowledge and sharpen your skills in preparation for the most important exam of your professional journey? In this video, we'll dive together into a carefully curated set of NCLEX-RN practice questions, designed to help you understand the nature of the exam and the types of questions you might encounter. We'll tackle each question individually, present you with the options, then reveal the correct answer and explain in detail why it's the best choice, teaching you how to think like a professional nurse. Whether you're preparing for your first attempt or looking to refresh your knowledge, this video is tailor-made for you. Let's begin our journey towards NCLEX-RN success. Question 1. A 68-year-old client with a history of heart failure is admitted to the emergency department with acute dyspnea and orthopnea. The nurse notes crackles in the lung bases, jugular venous distension, and 3+ pitting edema in the lower extremities. Which of the following is the priority nursing diagnosis for this client? A. Impaired gas exchange. B. Fluid volume access. C. Decreased cardiac output. D. Activity intolerance. Answer: A. Impaired gas exchange. Rationale: while all options are relevant, acute dyspnea, orthopnea, and crackles indicate compromised oxygenation and ventilation, making impaired gas exchange the most immediate life-threatening concern. Addressing oxygenation is the priority in acute heart failure exacerbations, as hypoxia can quickly lead to severe complications. Question 2. A nurse is caring for a client with a new colostomy. The client is reluctant to look at the stoma and states, "I'll never be able to live a normal life with this." Which of the following is the most appropriate nursing intervention? A. Provide the client with a list of ostomy support groups. B. Encourage the client to verbalize feelings and concerns. C. Demonstrate how to change the ostomy appliance. D. Reassure the client that life will return to normal with time. Answer: B. Encourage the client to verbalize feelings and concerns. Rationale: this intervention directly addresses the client's emotional distress and facilitates coping. Providing support and a safe space for expression is crucial before moving to practical skills or support groups. Expressing feelings helps the client process the physical and psychological changes they are experiencing. Question 3. A 45-year-old client is diagnosed with type 2 diabetes mellitus. The nurse is providing education on lifestyle modifications. Which of the following statements by the client indicates a need for further teaching? A. I will try to exercise for at least 30 minutes most days of the week. B. I can still eat whatever I want as long as I take my medication. C. I will monitor my blood sugar levels as my doctor instructed. D. I understand the importance of maintaining a healthy weight. Answer: B. I can still eat whatever I want as long as I take my medication. Rationale: this statement indicates a lack of understanding regarding the importance of dietary management in type 2 diabetes. Medication alone is often insufficient, and lifestyle modifications, especially diet, are cornerstones of treatment. The client must understand that a healthy diet is an integral part of diabetes management. Question 4. A nurse is preparing to administer digoxin to an infant. The nurse assesses the infant's apical pulse and notes a rate of 88 beats per minute. Which of the following actions should the nurse take? A. Administer the digoxin as ordered. B. Hold the digoxin and notify the physician. C. Administer half the prescribed dose. D. Recheck the apical pulse in 30 minutes. Answer: B. Hold the digoxin and notify the physician. Rationale: the normal apical pulse for an infant is typically 90 to 160 beats per minute. A pulse of 88 BPM is below the safe threshold for administering digoxin in infants, usually less than 90 to 100 BPM, depending on facility policy. Digoxin can cause bradycardia, so it's crucial to assess the heart rate before administration. Question 5. A client is receiving a continuous intravenous infusion of heparin. The nurse notes the client's activated partial thromboplastin time, or APTT, is 95 seconds. The therapeutic range is 60 to 80 seconds. Which of the following actions should the nurse take first? A. Increase the rate of the heparin infusion. B. Decrease the rate of the heparin infusion. C. Administer protamine sulfate. Or D. Notify the physician. Answer: B. Decrease the rate of the heparin infusion. Rationale: an APTT of 95 seconds indicates that the client's blood is too anticoagulated, significantly increasing the risk of bleeding. The first action should be to decrease the infusion rate to bring the APTT back into the therapeutic range. Protamine sulfate is the antidote, but is reserved for severe bleeding or excessively high APTT levels, often after notifying the physician. Question 6. A nurse is caring for a client with schizophrenia who is experiencing auditory hallucinations. The client states, "The voices are telling me to hurt myself." Which of the following is the most appropriate nursing response? A. Are the voices telling you to hurt anyone else? B. Those voices aren't real. You need to ignore them. C. I understand you're hearing voices, but you are safe here. D. What exactly are the voices telling you to do? Answer: C. I understand you're hearing voices, but you are safe here. Rationale: this response acknowledges the client's experience without validating the hallucinations as real. It also provides reassurance and focuses on the client's safety, which is paramount when a client reports self-harm ideation. It maintains a therapeutic and supportive environment. Question 7. A 28-year-old client is admitted with a suspected ectopic pregnancy. Which of the following assessment findings would the nurse expect to prioritize? A. Nausea and vomiting. B. Unilateral abdominal pain. C. Breast tenderness. D. Frequent urination. Answer: B. Unilateral abdominal pain. Rationale: unilateral abdominal pain, often described as sharp or stabbing, is a classic symptom of an ectopic pregnancy and can indicate a rupture, which is a medical emergency due to the significant risk of hemorrhage. While other symptoms might be present, unilateral abdominal pain suggests a more immediate and potentially life-threatening complication. Question 8. A nurse is providing discharge teaching to a client with a new prescription for warfarin. Which of the following statements indicates effective teaching? A. I should increase my intake of green leafy vegetables. B. I will take aspirin for any headaches I get. C. I need to report any unusual bleeding or bruising to my doctor. D. I can stop taking this medication when I feel better. Answer: C. I need to report any unusual bleeding or bruising to my doctor. Rationale: warfarin is an anticoagulant that significantly increases the risk of bleeding. Clients must be aware of and report any signs of unusual bleeding or bruising immediately to prevent serious complications. Increasing green leafy vegetables, high in vitamin K, can interfere with warfarin's effect, and aspirin also increases bleeding risk. Stopping the medication without consulting a doctor can lead to dangerous clotting. Question 9. A nurse is assessing a client with a traumatic brain injury. The nurse observes unequal pupils and sluggish reaction to light. Which of the following is the most immediate concern? A. Intracranial pressure elevation. B. Spinal cord injury. C. Seizure activity. D. Hypoglycemia. Answer: A. Intracranial pressure elevation. Rationale: unequal pupils and sluggish reaction to light are classic and critical signs of increasing intracranial pressure, or ICP, which can lead to brain herniation and severe neurological damage or death if not addressed promptly. This is a neurological emergency requiring immediate intervention. Question 10. A client with a urinary tract infection is prescribed ciprofloxacin. The nurse should instruct the client to avoid which of the following while taking this medication? A. Dairy products. B. Alcohol. C. Caffeine. D. Grapefruit juice. Answer: A. Dairy products. Ciprofloxacin, a fluoroquinolone antibiotic, can have its absorption significantly reduced by dairy products and antacids containing calcium, magnesium, or aluminum. These should be avoided for several hours before and after taking ciprofloxacin to ensure optimal drug effectiveness. Question 11. A nurse is caring for a client with a history of asthma who is experiencing an acute exacerbation. The client's peak expiratory flow, PEF, is 60% of their personal best. Which of the following is the nurse's priority action? A. Administer a prescribed oral corticosteroid. B. Encourage deep breathing and coughing exercises. C. Administer a rapid-acting bronchodilator. D. Assess the client's oxygen saturation. Answer: C. Administer a rapid-acting bronchodilator. Rationale: a PEF of 60% of personal best indicates a moderate to severe asthma exacerbation. The priority in an acute asthma attack is to open the airways to improve breathing. Rapid-acting bronchodilators, for example albuterol, provide quick relief by relaxing the smooth muscles of the airways. While assessing oxygen saturation and administering corticosteroids are important, bronchodilation is the immediate life-saving intervention. Question 12. A client is diagnosed with a deep vein thrombosis, or DVT, in the left leg. The nurse is developing a plan of care. Which of the following interventions should be included? A. Apply warm compresses to the affected leg. B. Encourage ambulation as tolerated. C. Elevate the affected leg. D. Vigorously massage the affected leg. Answer: C. Elevate the affected leg. Rationale: elevating the affected leg promotes venous return and helps reduce swelling and discomfort associated with DVT. Applying warm compresses is generally not recommended, as it can increase vasodilation and potentially dislodge the clot. Ambulation is often restricted initially, and vigorous massage is contraindicated due to the high risk of dislodging the clot, which could lead to a pulmonary embolism. Question 13. A nurse is providing education to a pregnant client about potential signs of preterm labor. Which of the following statements by the client indicates a need for further teaching? A. I should call my doctor if I have regular contractions every 10 to 12 minutes. B. I will report any feeling of pressure in my pelvis or vagina. C. A sudden gush of fluid from my vagina is probably normal. D. I should be aware of any persistent dull backache. Answer: C. A sudden gush of fluid from my vagina is probably normal. Rationale: a sudden gush of fluid from the vagina is a significant sign that could indicate rupture of membranes, water breaking, which can be a sign of preterm labor or a risk factor for infection. This is not normal and requires immediate medical evaluation. Regular contractions, pelvic pressure, and persistent backache are all potential signs of preterm labor that warrant reporting. Question 14. A nurse is caring for a client who is prescribed restraints. Which of the following actions is a priority for the nurse? A. Document the client's behavior and the rationale for restraint use every 8 hours. B. Ensure the restraint is tied to the movable part of the bed frame. C. Remove the restraints every 4 hours for a range of motion assessment. D. Obtain a new physician's order for restraints every 48 hours. Answer. B. Ensure the restraint is tied to the movable part of the bed frame. Rationale. This is a critical safety measure. Tying restraints to the movable part of the bed frame, for example, side rail or bed spring, ensures that if the bed position is changed, the restraint does not tighten or cause injury to the client. Tying to a stationary part could lead to serious harm. Documentation, frequent assessment, typically every 2 hours, and new orders, often every 24 hours for adults, less for children or adolescents, are also important, but ensuring safe application is the immediate priority. Question 15. A client is experiencing an allergic reaction to a bee sting, manifesting as widespread urticaria, facial swelling, and difficulty breathing. Which of the following medications would the nurse anticipate administering first? A. Diphenhydramine, Benadryl, B. Epinephrine, C. Prednisone, or D. Ranitidine, Zantac? Answer. B. Epinephrine. Rationale. The client's symptoms, difficulty breathing, facial swelling, and widespread urticaria, indicate a severe allergic reaction, likely anaphylaxis. Epinephrine is the first-line and most critical medication for anaphylaxis because it acts as a bronchodilator, vasoconstrictor, and decreases histamine release, rapidly reversing the life-threatening symptoms. The other medications may be used as adjuncts, but are not the immediate priority for an acute, severe reaction. And that brings us to the end of today's NCLEX-RN Deep Dive. We truly hope you found these questions and detailed rationales incredibly helpful on your journey to becoming an outstanding registered nurse. Every step you take, every question you master, brings you closer to that dream. If you found value in this video, please show your support. Hit that like button to let us know we're on the right track. And more importantly, subscribe to the channel so you don't miss out on any future NCLEX-RN prep content, expert tips, and essential nursing insights. We are building a community of future nursing leaders here, and your support helps us create even more valuable resources for you. Don't forget to ring the notification bell so you're always the first to know when a new video drops. And if you have specific topics you'd like us to cover or more questions you want us to tackle, let us know in the comments below. Your feedback fuels our content. Keep studying hard, keep believing in yourselves, and we'll see you in the next one, ready to conquer NCLEX-RN.